Hi there, everyone. Good evening and welcome to Conversations with MM. This is another episode of our podcast here in New York and all over the US. Kumusta kayo dyan? I hope you're enjoying the weekend. It's early autumn, so medyo malamig na, tugnaw na. So it's the sweater weather, and we're still here to give you the best of our efforts in the community leaders and advocates of social change. Okay, so for this episode, we are honored to have the women leaders, the front runners of Apicha Community Health Center, which is stationed in Manhattan and Jackson Heights. Apicha is our guests are the CEO, Ms. Therese Rodriguez, who is a Filipino American, and the COO, the Chief Operations Officer, Ms. Mihaela Mihai, and she is. They are amazing women who are running Apicha. Now, Apicha is born out of the local struggles of people afflicted with HIV/AIDS in the 1980s. That was the start of the struggle. And Apicha is now a federally accredited community health center, and it has expanded and provided more services to the community, such as child care, women's health care, mental health care, dental. So it has evolved, it has morphed. And thanks to the leadership of our current crop of women leaders at the helm, uh, Therese and Mihaela. And so I'd like to show you the picture of Apicha in Jackson Heights, which is a heavily immigrant community area in Queens, New York. Okay, so that's Apicha. The staff are very friendly. And so without before I proceed to the main interview, the main conversation, I'd like to remind you again to take take time to listen and watch the upcoming performance of the Philippine Ballet Theater, brought to you by the Foundation for Filipino Artists. Take a look at this. Okay, there you go, ladies and gentlemen. So kindly take note of the date. This is going to be October 5, Saturday, at the LaGuardia Performing Arts Center. on 31-10 Thompson Avenue on Long Island City. And tickets are at $25 for matinee, which is 2 o'clock, and gala, which is in the evening at 6 p.m. for 50, 75, and $100. So bring your family and friends to this wonderful show. It will provide us with excerpts from Ibalon. This is the love story of Han Yong and Oriol, and excerpts from the Nutcracker. So these will be performed by the great performers of the Philippine Ballet Theater. So take note of that and support local artists and enjoy with family and friends. Okay? So now I'm going to tell you about our wonderful guests, our conversation very soon with Miss Therese Rodriguez, the CEO of Apicha, and Miss Mihaela Mihai, who is the COO of the said center. Now, remember, ladies and gentlemen, that I just would like to give you a context that the Apicha, according to Therese, is a gift of the LGBTQ community to New York. It because it morphed as a local struggle of disenfranchised persons afflicted with HIV/AIDS, nurses, doctors, and community activists who pushed for their rightful place of care and healing, especially in the 1980s. Now, Apicha originally was known as the Asian and Pacific Islander Coalition on HIV/AIDS. This group lobbied before U.S. Congress to change the word other in government health records of individuals into specific races that abound in the U.S., especially Asian and Pacific Islanders. So thus was born the word inclusion, to include others into the fabric of American society. So that's the anecdote which Therese had given me in our recent conversation. So let's take a listen to this. Ms. Therese Rodriguez and COO Mihaela Mihai.
Apicha has been serving the community uninterrupted service from 1989 to the present. We have met every payroll, no time when we did not pay our payroll and continue to grow. Apicha is also a, a place, it's a laboratory for developing, leadership and specifically paying attention to the women leadership. It is a place where we encourage it. It's a place where people will be able to understand their sense of power, that they're not just delivering services, that they're here to be able to develop an understanding of what are the needs of the community and be able to translate them into action, either in policy changes or leading other nonprofit organizations or themselves become the policymakers.
There you go. So let's now take a listen to the entire interview that I did at the office of Apicha, ladies and gentlemen. Thank you so much, Mihaela and Ms. Therese, for joining us today with Conversations with MM and for welcoming me here in Apicha in Jackson Heights. Kamusta po? I hope everything's doing good this year. So far, we're entering the season of fall, which is the loveliest for me. Kamusta na? Everything's good? Tell us about Apicha and how it came about here in Jackson Heights, Ms. Therese.
Um, in at the height of the epidemic, many of the uh, many of the misconception about the epidemic is that it is mainly a white man's epidemic, and so there's a lot of no attention was given to communities of color, then especially the Asian and Pacific Islanders, who have also different notions that they are not susceptible to the HIV infection.
Mm-hmm.
But initially, when when the Filipino nurses were discovering and were encountering a lot of young gay men in hospital beds abandoned by their families and did not have any resources whatsoever. And so many of them banded together and took care of the dying young Filipino and Asian men. What they had to do at that time was to be able to deal with the lack of attention by family members because they were not accepted by the family either because
Mhm.
the HIV stigma and
Mhm.
because of the homophobia that was very strong at that time. So many of these nurses were asked by these young men, we're taken care of by this. The nurses took care of these young men, bathing them, brushing their teeth for them because they were totally unable to take care of themselves. As the relationship continued, many of the young men asked that could you we're longing and we're hungering for Filipino food. And so as a result of that, the nurses banded together in what's called the Piambrera group, which is the stacking of this, way of putting food in stacks and delivering them to
Uh-huh.
the young men.
What year was this?
This was in the 80s,
Okay.
right? And so when one of the things that the young men also requested was that if they die, they want to be buried under the acacia tree in the Philippines, so that they can, they can be in not in the heat, but in the coolness of the tree.
Earth.
And so this also these nurses, formed what's called the Acacia Fund, and they collected funds to be able to take care of the cremation as well as the sending of the remains back home. Um, the on the other side of what's going on in the API community, there were young gay men, API young gay men, and Japanese American civil rights uh, activists who banded together, and because along with the indigenous people, we were not being counted in the age surveillance data. We were these two communities, large, very complex communities, were put in the category other. And so together they joined and went to Washington D.C. and advocated for the need to be taken out of the category other. And with that work and with the empathy and sympathy by the particular, Washington officials from CDC and Health and Human Services, two census columns were created, one for APIs, Asian and Pacific Islanders, and for the Native American Indians. So that was a huge victory for advocacy as well as partnership with the government, which led to the resources being, opened up for these two communities. Out of that advocacy work, Apicha was formed and founded by this group, and they coalesced and still continued to work with each other and formed Asian and Pacific Islander Coalition on HIV/AIDS. The acronym is Apicha.
Amazing. So the other became more specific into Filipino, Asians, and all the other.
What that would be the Asian and Pacific Islanders, which as as big a bucket as being lumped in the other category.
That's a major gain or victory.
Right, because in that category API, there were about 48, racial ethnic groups speaking in 100 languages. And so at the beginning, Apicha without the development in biotechnology at that time, could only do quite a bit of case management and dealing with the alienation of these young folks infected by HIV. And it was also important for us to work in the community to deal with the homophobia and the stigmatization of the disease. That that work was supported, initially by Mayor Dinkins, who was one of those who gave the first funding to Apicha.
At that time, were you already in Apicha and
Not yet,
organizing? Not yet.
not yet.
What year did you come in?
1997, right? So this was the Apicha was founded in 1989.
It has a long time coming.
Yeah, it was a grassroots, mainly a grassroots, until it was uh, given funding, and that's when I was brought in to be the deputy executive director.
I see.
Because it was the transformation from from a grassroots organization required organizing skills as well as administrative skills, and thankfully, because of my background of organizing in the Filipino American community in the struggle against the Marcos dictatorship and fighting for the racial uh, and minority equity of the Filipino American community, um, I have developed some skills in not only organizing but also being able to deliver the message to the community. So, with those resources, case management, social bringing in of social groups, get people away from alienation, because it's a very alienating disease, and as we were doing that, a lot of the folks who became our clients and later patients were saying to us, it's so difficult to deal with the fragmented, medical system, public health system. They have difficulty with language because most of the people we were serving were limited in English proficiency.
I see.
One of the things that we did was to train providers and develop a brochure in 19 languages to deal with as much as we can in terms of education, right? But it brought us to a reality that a lot of hand-holding needed to be done in order to take care of the clients. Just bringing them to the hospital and finding out where the HIV unit is, being able to bring them to the social services if they needed insurance, housing, and all of those. We took care that as much as possible of what we can do about that.
That's great.
Right. And so at a certain point, they say, why don't you just bring the doctor in? Because it's so hard to navigate the hospitals and bring them in. And that's when we brought the Ryan White money to build primary care for people living with HIV/AIDS.
At this time, there was still no, the medication.
What we were having at that time were this therapy, a lot of medication to be drank, during the course of the day. It should be refrigerated. You have to have stable housing. There's all of those things that we were able to, that was the only thing that was available at that point. And there was one particular medication that was not the most effective either. So when we advocated to bring in medical care into Apicha, and so thus created what's a comprehensive one-stop shop, Apicha. So we had the case management, the kind of socialization, and the medical, primary care for people living with HIV/AIDS.
So until now, you still have that services?
Yes. However, the partners of those who were infected were also at high risk for HIV.
Right.
And they could not use the services that we have because the funding was only for those who were infected with HIV. And so we advocated to bring in, and much, much later, right? Because it's always a struggle to take care of the marginalized population, especially because the HIV was largely carried, well, the LGBT community took the brunt of that epidemic. So that whole period is when we got introduced to uh, the medical field, and how if you keep not only healthy, able to be mentally and spiritually prepared, right? The primary care was a way of keeping the rest of the body, as healthy as possible, spiritually, mentally, and medically. And with that, and bringing in, we then expanded to bring in the LGBT, you know, community into our care for primary care. That's how we began to expand into not just being case
What year
management.
did you begin to expand to other services?
Well, that was about 2007, 2000, year 2000, when our program officer and evaluator, Chandi Ghosh, said to us, if you are going to stay in HIV, you cannot just take care of APIs. If you are just going to take of APIs, you cannot just provide HIV services. So we were at that crossroads of how do you expand and become, more than just an AIDS serving organization. And so we began to look for and be able to take care of the community of the LGBT community. And so we began the process of adding it, I think in 2005, we brought in the transgender well health and wellness clinic, because they had very specific demands, saying we don't have HIV, but we have needs for hormones. And so you can you take care of us? We are at risk, right? But we're not infected. So that began the process of saying, hey, we have expanded so much. How do we take care of the folks? And that's when we began thinking of that becoming a federally qualified health center.
So you've been growing and growing.
Yes. And based off the needs of the community that were really saying to us, this is the way to take care of us, right? And so we responded to at every juncture.
These are like learning curves.
Learning curves, as well as the partnership between advocacy and service. You cannot just, keep service, because it has its limitations, right? You have to keep advocating so that those services always, are aligned with the needs and expanding needs of the population. The advocacy to become a federally qualified health center.
Is that a very steep challenge?
Yes, it is, because we are only taking care of people with HIV. The concept, right, of the FQHC, that's a federally qualified health center, is that in order for you to gain that, that designation from the federal government, you've got to be taking care of the community where you are located.
Yes.
So it can't just be HIV.
It's a major requirement.
Right. And then the other one is, statutorily, there were only several, designated special populations, which are the homeless, those living in public housing, and the migrant workers. And our advocacy at the time was, we've got to be considered a special population, because this population has been marginalized by society, and that they suffer from a very huge disparity in terms of health.
Right.
But it's always that belongs to in the realm of politics.
Right.
And so, as a small organization or without political power, that was the hardest,
So how did you network with advocates who are also politicians?
Well, yes, we walked the congressional halls. We went to the White House. We went to HRSA. and we develop relationships, deepen our relationships with the LGBT community, not just us here in the city, but nationally. And as a result of that, you know, we were very fortunate at that time that the Affordable Care Act wanted to expand Medicaid, and in that expansion,
Oh.
7 AIDS service and LGBT organizations were included to be funded to become a federally qualified health center.
Congratulations then.
Yes,
Wow.
but the difficulty is, how do you transform, an agency that's just taking care of one disease, limited population, to become now a you know a population serving the larger community.
Right.
And there were women, children, people who were seniors, and other folks with not only HIV but have diabetes, hypertension, heart disease, and stuff like that. So uh, that's where we are now. We are expanding the work. That's why we're launching the women's health services soon,
Yes.
and we are really deepening our understanding of the populations that we're serving here in Jackson Heights and in Manhattan,
Yeah.
in order to deliver what is it that in our name, Apicha Community Health Center, right? That we underline community and we underline health. And how do we undertake that? Because it's almost like I always use this analogy. It's almost transforming a taco truck into a restaurant, right? And it's a very
Challenging.
challenging. The curve is very steep. We are beginning to understand more and more, not only of the challenge, but also through national associations of community health centers and the Community Health Association in New York State. We are gaining as much knowledge as we can, and now we have also been. We're also always trying to do continuous needs assessment, so that we're continually, um,
Relevant.
relevant, as well as we become owned by community. We're
Right.
not just owning the community. There should be that interaction.
Like there's a buy-in.
Buy-in.
So I'll ask Mihaela, what are the programs now that the Apicha is providing after a very long, wonderful history of struggle? Yeah.
So Apicha has continued to grow, as you heard from Therese. And at the core of what we do is patient-centered medical home. And how do you provide patient-centered medical home? You make sure that you have not only the medical services, but you have community health education. You have people who go out into the community and educate about health needs, help with the health insurance enrollment, assistance with SNAP enrollment, having case management, to address the social determinants of health, because we know that somebody who is experiencing homelessness or food insecurity will not prioritize their health over making sure that they have food to put on the table for their family. So our case managers will look to see what are those other factors that can impact a person's health, and how can we address them so we can allow the space for that person to concentrate on their health. And when it comes to health, it's not only the physical health, it's the behavioral health. We have primary care for adults, for children, pediatrics. We offer women's health services, like you heard from Therese, dental services, as well as mental health and substance use services. All of these work together to help a person lead healthy and long life.
Do you have like a feedback mechanism where you're able to find out the impact of your services to a client?
Have multiple ways in which we gauge how are we doing.
Yeah.
So we have the quantitative way where we look to see what's the percentage of our patients that have controlled their diabetes, controlled their hypertension, received the preventable cancer screenings. So that's one quantitative way. But we also then have patient satisfaction surveys, and we gather stories because we know that the stories are so powerful. I'll give you an example. When we opened our Jackson Heights Center in June of 2022, we started to see a lot of the patients coming here who were uninsured, and because of that, they didn't have access to health care. So they were coming to us with advanced diabetes, advanced hypertension, and we have a story of a woman from South America who came to us and had many different health complaints. But one of the things that she has shared with us was that for many years, she knew that she has diabetes, but she didn't take any medication because at that time, diabetes medication was very, very expensive. And also because her status, she wasn't able to go to the doctor and take care of her health. So when she came to us, her diabetes was really uncontrolled. And within that first visit, our medical provider was able to prescribe for her the diabetes medication that she was able to get for less than $1 from our on-site pharmacy. And then that person was able to stabilize her health so she can continue to live a productive life.
That's really heartwarming. Like saving lives is the most important. But personally, on both of you ladies, like you have chosen to be here in Apicha. Why and what did this kind of service do to you? Particularly Therese. Therese is like a an icon in community struggles. Why are you persisting? Why are you still doing this?
I think Apicha and many other issues that I worked in, the pro-democracy for the Philippines, as well as the struggle of Filipinos
Yes.
in the United States as immigrants. And I think I must also credit my family for raising me the Christian way, right?
Yeah.
Which is generosity and kindness, especially to those who suffer and are poor. When you have a life that is of such teachings, right? As well as being able to see that it is possible for us to lift the situation of people rather than get down to the level of poverty, right? It's a very strong impetus to fight for those issues.
Yes.
So that's one. And whenever I hear those stories of success, of just being able to take care, right, of an individual, or even if it's not our work, somebody calls me from community and says to me, "Can you take care of my aunt who lives in that area because she's being evicted by the landlord, and because she's been there for 40 years, right? Is there a way that you can help?" I mean, that's the kind of interaction from the community that fills you with a desire to keep helping. Then I also get visitors from my high school classmates who came last, and they say to me, "Can't we have an aperture, in the Philippines? Can you go home and set up something?" And say, "Oh, I wish I could go home." But this kind of work is a belief and trust in the community, but also with your partners, like the state and specific the CDC and the HH S and so HRSA, all of these funders who who do not have bureaucrats. They have advocates internally
Mhm.
to take
Yeah.
care as well.
Yeah.
And they receive the data that we provide them, and they look into it with us. So that's the kind of, you cannot just do it, from
On your own.
on your own. You've got to have the partners that's necessary. And this experience has taught me that life is a lot about possibilities rather
Mhm.
than just sorrows and
That's good to
and
hear from you.
difficulties, right?
Yeah.
So if you keep that kind of thinking, it makes you dream more
Mhm.
and want to do more. So it's almost like I would tell her, oh, I wish I was 10 years younger because we could do this and we could do that. And
Sky's the limit.
it's always like that. And
Uh-huh.
so it's been a very blessed life
Mhm.
to have that alignment between what you believe in and what you can do.
That's great. So inspiring, Therese. Now I'll ask Mihaela, what's also your motivation? Why are you doing this personally?
Although I haven't been at Apicha for as long as Therese has been, I have been for the past 16 years.
Oh, that's a long time.
It is a long time. And I first joined Apicha because of the work they were doing on HIV and AIDS.
Mhm.
I first learned of HIV and AIDS in Romania, where I grew up.
Okay.
And when I was a teenager, I became involved with an organization that was taking care of children dying of AIDS.
Mhm.
Um, and
In Romania.
in Romania,
Oh, okay.
where children were abandoned by their families in orphanages. And this organization created a house for children dying of AIDS.
Mhm.
So that's where I first learned about HIV, how devastating it was. And when I came across the job opportunity with Apicha, I jumped on it.
Mhm.
But that's how I started. The reason I stayed is because the work that I'm doing here at Apicha is meaningful. And I work with a group of wonderful people for whom sky is the limit.
Oh.
We don't see barriers. We don't see you cannot do. We listen to the community. We hear what is needed, and then we find ways of getting things done.
That's amazing. You're both amazing. And like, it's really right here in our neighborhood in Jackson Heights. It's like, and how about in Manhattan? You're both overseeing the cases in Manhattan as well.
Yes.
Uh-huh.
And Manhattan is a little bit different from Jackson Heights.
What's going on there?
The clinic, because it's the first clinic and part of our very intense evolution, right, from an HIV organization. Who we have in Manhattan in terms of the patients are largely male. We have a very large population of the LGBT community over there, and they're not necessarily just in that neighborhood where they are at the one block of canal in the Tribeca Chinatown area. It's become a magnet for those folks that we have served, our foundational population, the people living with HIV/AIDS, the LGBT, and the transgender community, and they come from different parts of the city. In fact, I think they come from what practically at that time when we were looking before we opened this, and we continue to look that way. That our population comes largely from the whole city.
Oh, so you're catering to a huge group,
Right.
and different ages?
In Manhattan, we have patients over 18 years old. So between 18 and I think our oldest
18.
patient is 86 now.
Oh, okay. Wow. Can you, Therese, can you give us a sense of the level of stigma before in the 1980s and now? Has there been a qualitative decrease of stigma about the disease? Has it
It's not
lowered?
as pronounced,
Uh-huh.
but when we started and there was a development of HIV testing,
Mm-hmm.
we would go to, let's say, to Union Station. No, it's not
Union Square.
Union Square, right? And participate in health, health fairs,
Mm-hmm.
and you would hardly be able to test any API,
Mm.
maybe one or two.
Okay.
But now when it's become such a routine part, for the APIs, but we still need for them to hear
Mm-hmm.
more and more about the pre-exposure prophylaxis, which not only takes care of the lowering of the viral load along with other medication for one who's infected,
Mhm.
but if you're not infected and you take on this pre-exposure prophylaxis, you will then not be infected even if you have intimate relationships
Mm-hmm.
with one who's infected, which means that the community viral load is being lowered
Yeah.
and the spread is getting less and less, pronounced as before. So that's what. But how do the services come down is still going to be, how how much how much we how much attention that we get from the public health, right?
Mm-hmm.
Because many times um, we are still our numbers are still very small compared to the bigger populations, and that type of comparison of our numbers against big populations always dwarfs us in
Mm-hmm.
terms of our numbers as well as the resources that come to us.
Mm-hmm.
So there's this system called dynamic prioritization system where you will get counted. There's no question, but you're always outside of the bell curve, and so you're always an outlier.
Like
And
still marginal.
yeah, marginal. And if you're that, the resources are limited, and so if it's determined that it's the five highest rates that would get the the funding, you
Mhm.
never get the funding.
Mm-hmm.
And so there was a time, and we still have to recover from some of those lost funding, which is funding for men who have sex with men. I mean,
Mhm.
it's as if the APIs are not having sex with those in the,
Mm-hmm.
in the bell curve, and the education, if they're not in the language that many immigrant, right?
Mhm.
If it's not directed to them that there's such a thing as PrEP,
Mm-hmm.
right? They will feel that they are not included.
Mm-hmm.
So the level of inclusion still has to be intensified in order to reach those populations who are, by virtue of the hostility against immigrants, and if you're very newly arrived and you have language issues,
Mhm.
that the structural uh, issues continue to discriminate against those who have no access.
Right. Right.
That's why Apicha becomes a very important, you know, gateway to,
Mhm.
to gain those access. And so the more people like you in the media, uh, talk about, what us in the community who are
Mhm.
providers, talk about the services, the more and through the different platforms, the different social networks and
Mhm.
stuff like that, it would help. So, and we did a little bit of study,
Mhm.
a survey that we did last year to look into the needs of the API LGBT.
Is the change, for example, of a national president, the presidency, the administration, will it impact on the budgets that you have?
It could,
Or
if,
it
if
could?
yeah, it could if there's going to be decimation of the idea of uh, 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 repealing the Affordable Care Act, right?
Oh, okay.
Because the Affordable Care Act is the
Mhm.
expansion of primary care.
Right.
It is the expansion of people who are in Medicaid and therefore poor, right?
Mm-hmm.
Are brought into care, right? When those infrastructures which brought in millions of people are taken away, you create a major crisis, right? Because of the way it's going to be just turned off overnight,
Mm-hmm.
right?
Yeah.
So those are the things. So
That's a threat.
right,
Mm-hmm.
hospitals will close, right? there will be little less and less resources that will be possible. The intense competition and division is just going to continue to divide communities. Will be we will be pointed at immigrants, right, as the ones who are taking away
The
the
resources.
resources, right? I
Mhm.
mean, that's what is going to be the national narrative about who we are.
Mhm.
And if we should correct that, because
Mhm.
first of all, those are lies and they're
Mhm.
not true. Our contribution to society has been so evident in terms. Exactly.
Yes, so let's look at the perspective of Apicha. What's your plan in the next 5 years, for example? Well, we begin with like the launching of your women's service program because that's happening soon. Tell us about your perspectives for the community health center.
Um, it's very important for us to really look at some of the social determinants of health, for
Mhm.
example, and see how we can begin to sharpen those relationship a little bit more. You know, there's just so many. Uh, there's just so many ways of uh, poverty eats up, the resources of people, and having just a clinic here is not going to resolve that, right?
Yes.
Right? So we might have to, look into some partnerships with government and other organizations on how do we become, right, part of a building of a, a much more accessible society, right?
Mhm.
The one that can make people feel if they work hard, they will have a home to go to.
Mm.
It's a it's it's not going to eat up salary that
They earn.
they earn. So there's many of those things that I think that um than really saying that the education around and mental health is going to be a very important part of it, especially as in this neighborhood a lot of folks are abused
Mhm.
and threatened at the border, are
Mhm.
trying to build their lives, and we should be alongside that building of their lives. So um, we can keep dreaming and see how we can also improve the quality of care.
Mhm.
So within the medical work, if we committed to the outcome measures, how to take care of the health of people,
Mhm.
the social, with the social determinants of health, we will save a lot of money for society
Right.
because we're going to prevent the unnecessary use of the ERs and avoidable hospitalization.
Mhm.
And that's a great contribution to society. So much of that can be released for housing,
Yes.
for better transportation,
Yeah.
uh, cleaner environment.
Right.
So yeah. So I mean, if you think about it, it will release the capital into is the picture of the future.
Why, nicely said. Like if you have healthy people, you'll have a healthy society, a robust people working for the economy and happy
Right.
families.
Exactly.
Right.
Because that's the pattern of many immigrants. The instability happens just at the beginning, and
Mhm.
after that
They work so hard.
they build businesses, they go to schools, they go to theaters, they enjoy life, right?
Yeah.
And so those industries become as robust as
Vibrant.
their
Yeah.
as the development of their livelihood.
Mhm.
So,
Because like I would see like immigrants should be seen as like you're a labor resource and you're a consumer resource. Like you really make society tick
mhm,
and
that's
become
the organic and natural way that people live.
like you are the core. Taking care of the health of people
Mhm.
is the beginning of progress.
Yes.
I understand that very well. And then how about Mihaela, looking at the perspective aspect of the community center and you personally, you'll still be here for sure to to see things through?
I think what's important in a health center
Mm,
is not to think of it as just the place where you go to get health services, but
mhm,
the health center is really a contributor to the local economy,
mm,
right? You hire people from the community,
mhm,
you help that community thrive.
mhm,
One of the things we haven't spoken about is how um, part of what we do in Jackson Heights, we also have a community space,
mhm,
and it's a space that we created um, as a gift to the community, so we can bring in partners, community-based organization, um, others who can bring education and services to the community.
mhm.
Um, because we are not an island, we are part of the community. And the only way to get the community to be robust, to thrive,
Mhm,
is to work with others and lean on each other's strengths
mhm.
in order to impact the larger community. And I think that's work that's always happening. It's
Yeah.
not something that will end. And what's important for community health centers, and I think that's something that was evident with the COVID-19 pandemic,
Mhm,
was how agile health centers were to
mhm,
respond to that crisis. How immediately we shifted the way we did rendered services. We went from in person to
to
video
online.
appointments so fast. We were able to have our staff shift from some of the things that they were doing to provide COVID vaccine education
Mhm,
and health fairs. And I think that's the beauty of working in a health center, and especially if people are passionate about the work they do, that you just need to pay attention,
mhm.
see what's happening in the community, and see how can we respond to those needs.
That's great. Thank you so much. Wow, ladies, that is a very substantial and very encouraging conversation with you. Thank you so much for your time and all the best to Apicha, and may your tribe increase. Okay, that was the wonderful Therese Rodriguez, CEO of Apicha, and Miss Mihaela Mihai, the COO. They were talking about the services of Apicha. They are in Manhattan and in Jackson Heights, ladies and gentlemen. So that's been our wonderful conversation with the two women leaders. And so if you are we would really, really encourage people to go to Apicha and get their primary health care there. Nobody is turned down. You can go there and be given service that you need. But a very important thing that I'd like to point out is like if you have insurance, they accept most insurance there, and they really appreciate if people with insurance go there, so that it equalizes those who are being served and still having problems with their economic situation and could not buy their own insurance. So go ahead, go to the community center, Apicha, in Jackson Heights and Manhattan for your health needs and education at the same time. Okay, so that's been it for this wonderful episode today, ladies and gentlemen. I hope you learned a lot and inspired again by the leadership of our community health advocates and activists. So enjoy and take care of yourselves and take care of each other. So, but before I close, I'd like to thank um, Christian de Misones, my favorite musician, who has lent me another of his wonderful music, the Latin Jive Redux, which is now the opening and closing of our the opening and closing video of our podcast. So thank you, Christian. Take care, and Yep, that's it. And also remember to watch uh, Ibalon and the excerpts of the Nutcracker, which is on October 5, Saturday, on at the LaGuardia Performing Arts Center. And it will be for $25 matinee and 50, 75, and 100 for the gala, which starts at 6 p.m. Okie dokie. So, salamat for watching and see you again in our future episodes. Thanks again, Christian Demisonis.